Sports medicine deals with the diagnosis, treatment, rehabilitation, and prevention of athletic injuries, as well as the effects of exercise on the human body for the enhancement of athletic performance. Sports medicine is not restricted to the medical field. Athletic trainers, coaches, and personal trainers are also involved. There are two classifications of factors which lead to sports injuries: intrinsic factors and extrinsic factors. Intrinsic factors refer to mental and physical preparedness. Injuries can occur when activities are not consistent with your client's capabilities. Proper assessments and screening can help to avoid injuries arising from intrinsic factors. Extrinsic factors refer to those factors which impinge externally on performance, such as environment, clothing, nutrition, other coaches, and program design. Injuries arising from both of these factors are preventable. There are many different therapeutic modalities used in sports medicine that we should become familiar with. Diathermy is a form of high-frequency heat that penetrates injured tissues deeper and more effectively than other forms of heat therapy, such as moist heat packs and the like. Electrostimulation involves electrodes that create contraction of the surrounding musculature, reducing swelling by pumping fluid out of the affected tissue. Cryotherapy is the application of cold, usually in the form of ice or chemical ice, to body tissues for the purpose of pain relief and decreased swelling. Heat therapy is the use of heating pads or hot showers, which are best when followed with ice because heat alone causes static swelling. Ultrasound is high-frequency sound waves which oscillate to penetrate 1 to 2.5 inches into muscle tissue. Hydrotherapy is the use of water as a therapeutic, recuperative means. Cryokinetic therapy is very beneficial in reducing contracted, tightened muscle tissue, as well as pumping these tissues free of accumulated training-induced waste products. Leg elevation is used as a means to reverse hydrostatic or columnar pressure after a long day of standing or training. Many forms of therapy, including bodywork, such as massage and chiropractic care, are available to athletes at moderate cost and are highly recommended. The ISSA requires all certified trainers to have a current basic adult CPR and AED certification. CPR is an acronym for cardiopulmonary resuscitation. AED refers to the automated external defibrillator. Many health clubs and public locations have an AED machine on location to assist in the event of a cardiac emergency. You can contact the American Heart Association at www.americanheart.org to find a CPR AED class in your area that will meet your needs. In addition, you can also visit the Red Cross at www.redcross.org. CPR can be life-saving, and in addition to what you learn at your CPR certification class, it is important to remember these few key points. The primary survey for an emergency should include an inspection of the surroundings to check for overall safety. When it is determined safe to help the victim, check for responsiveness and alert the proper authorities if necessary. When assessing a victim, remembering the necessary steps of the primary survey is as easy as remembering your ABCs. These initial steps of checking the A, airway, B, breathing, and C, circulation, pulse, together with a check for major bleeding, constitute the primary survey. CPR courses can educate you on what to do next, including rescue breathing, chest compressions, and/or the Heimlich maneuver. The Good Samaritan law states that the helping person cannot be sued for additional injuries caused during the rescue attempt, even if it is less than perfect. Injuries often occur that are not life-threatening, and common athletic injuries can be treated with the Rice Principle. The Rice Principle is what emergency medicine professionals use to reduce the pain and inflammation associated with an athletic injury. It goes like this. Rest. Make sure the person is in a safe location, keeping any movement to a minimum. Ice. Apply ice or cold pack to the injured area. This is usually done in 20-minute intervals for several hours following the injury, or until medical attention can be received. Compression. Wrap the injured area with clothing or bandage, applying a fair amount of tension to the affected body part. Elevation. Elevate the injured body part above the level of the heart. In the case of an ankle, have the person lie on their back and rest their foot up on a chair or table. For diabetic individuals, insulin shock is a true emergency and requires prompt action. Symptoms of insulin shock include fast breathing, fast pulse, dizziness, weakness, change in the level of consciousness, vision difficulties, sweating, headache, numb hands or feet, and hunger. A person in insulin shock needs sugar quickly. If the person is conscious, give sugar in any form: candy, fruit juice, or a soft drink. Sugar given to a person in insulin shock can be life-saving. A stroke occurs when blood flow to the brain is interrupted. Symptoms can include any of the following: weakness or numbness on one side of the body, dizziness, confusion, headache, ringing in the ears, a change in mood, difficulty speaking, unconsciousness, uneven pupils, difficulty in breathing or swallowing, and loss of bowel and bladder control. If you suspect a person is having a stroke, have them stop whatever they are doing and rest. Promptly obtain professional help. Seizures are fairly common and can arise from a number of causes. Do not attempt to restrain a person suffering a seizure, and do not put anything in their mouth. Summon medical help and stay with the person until they are fully conscious. In order to administer effective first aid, it is important to maintain adequate supplies in each first aid kit. First aid kits can be purchased commercially already stocked with the necessary supplies. This concludes our Certified Fitness Trainer lecture series. As you've been reading your assignments, you've noticed that your course materials contain a great deal more information to allow you to pass your final exam. Don't hesitate to get in touch with an instructor if you have any questions about the material. Good luck in your studies, and we look forward to seeing your final exam.